It's a terrifying thought for parents, finding their newborn suddenly lifeless. But the reality is sudden infant death syndrome is a common issue here in Kern County. What's particularly alarming is that so far this year, 13 babies across the county have died as a result of unsafe sleeping environments. But many parents might ask, what does that unsafe sleep environment entail? And how can you make sure your little one is safe? Vanessa Dillon joins us now with answers to those questions. Vanessa?
Well, Maddie, it's a tragedy no parent should ever live through, yet the Kern County Child Death Review Team comes across cases every year. From 2012 to 2017, the coalition has reported over 40 infant deaths as a result of unsafe sleep environments. While most parents might think it could never happen to their children, experts advise the community to tread on the side of caution, keeping these safety tips in mind.
We on average see 2, sometimes 3 kids die to an unsafe sleep condition. It's hard, you know?
It's an issue experts like Tom Corson, board member of the Child Death Review Team and director for Kern County Network for Children, has had the hardest time processing. What's worse, some parents might think it can never happen to them, but the harsh reality is
it can happen to you. It can definitely happen to you. And there is no bigger loss for a parent than to lose a child and to bury a child. And I don't wish that on anybody.
That's why Corson and other experts are bringing awareness to the issue of an unsafe sleep environment, which could often lead to SIDS, or sudden infant death syndrome.
It gets frustrating when I got a stat like this, where there's 2 to 3 to 1 cases in each one of these reports of a kid dying needlessly because they were put in an unsafe sleep environment.
The conversation has been at the top of the county's priority list since the rate of reported SIDS in Kern County in 2017 was double the state rate. It's a clear indicator that the issue isn't going away, and awareness is crucial.
Just in 2019 alone, we're already going to be at 13. And we're not even in the cold part of the year yet.
But many parents may be asking, what exactly defines a safe sleep environment?
A safe sleep environment is a kid in a bed alone, on a tight mattress, on their back, usually in a onesie where they're tight, no blankets, no pillows, nothing around them at all. And that's what we're looking for.
And to clarify the steps for parents, they can always remember the ABCs of safe sleeping. A, being a baby sleeps alone. B, that they be placed on their backs. And C, that infant must always sleep in a crib.
This is preventable. And so why not prevent it? Why not educate?
Thankfully, preventative measures and resources are available to parents now more than ever before.
We've taken a number of different steps. Public Health has developed campaigns surrounding safe infant sleep. There's been the establishment of a Safe Sleep Coalition, where we have several different agencies that meet monthly to discuss this very issue to ensure that we are accurate and consistent in our messaging.
No matter what, parents must always err on the side of caution and strictly follow the ABCs of safe sleep, because the risk can be dire.
Imagine as a parent anything worse than losing a child.
And medical personnel is also the first in the state to be safe sleep certified, meaning staff are obligated to educate new parents during every delivery and doctor visit. You can find more information about SIDS and safe sleep on our website, kget.com. Just click on the hot link icon. In the newsroom, I'm Vanessa Dillon, 17 News.